Hi, my name is Morgan. First of all, thank you for taking time to review my application. I really appreciate your dedication to us students. I'm so excited that the time is finally here to apply for a clinical rotation at Craig Hospital. I have honestly dreamed of the opportunity to have a clinical at Craig for many years, even before I started the Regis DPT program. I had the opportunity to shadow at the hospital while I was still an undergrad and made the decision to attend Regis, partially due to the opportunity for a potential clinical rotation at Craig. While in the PT program, I have taken many opportunities to learn more about the amazing Craig community by attending a tour offered to a small group of our neuroanatomy class and also interviewing a pharmacist with a group of my classmates as a part of our pharmacology course this fall. These continued experiences with Craig have really only further solidified my eagerness to help individuals with complex neurological diagnoses such as TBI and spinal cord injury. I am also particularly interested in helping individuals thrive after TBI, as I had the opportunity to be by the side of one of my very close family friends as she started on her recovery journey from a TBI. In the last several years since her accident, it's honestly been such a privilege to be by her side as we've cried a lot together, but we've also laughed together too, and celebrated every success on her journey since. From helping her ride a horse for the first time again, and advocating for her to get her first job since her accident, it's really just been so special for me to walk this journey with her. And it really is a dream of mine to walk beside other individuals facing an uphill battle like my friend. I really feel I'm able to remain flexible in a clinical setting and stay calm and confident when some of those unpredicted situations arise. My past and current experiences in the inpatient setting have allowed me to kind of refine my ability to be flexible. Whether it's, for example, being willing to shift focus to lend a hand to a colleague when a chaotic situation arises, being creative in problem solving when, say, a patient doesn't speak the same language as I do, or being flexible in how I approach the plan of care with a patient because, say, maybe they really don't have any social support. Additionally, as I continue finishing my EMT certification and gain experience in this realm, I'm continuing to advance my ability to be flexible because, especially in this area of medicine, there's really very little predictability. Some of the strategies I use to be flexible and successful in this clinical environment include being as prepared as I possibly can and also practicing important skills often. Preparing by reviewing the patient charts in detail, if at all possible, allows me to have a good understanding of the knowns. So when some of those unexpected situations arise with the patients, I can easily adapt based on the knowledge I already have. I also find practicing important skills often allows them to become a bit more of muscle memory when I need to adapt to a situation quickly. In my first rotation in an inpatient rehab hospital, my CI noted that I could sometimes improve my efficiency in my new patient evaluations, and I was sometimes taking a bit too much time to get history before completing the necessary tests and measures. I accepted this constructive feedback by reflecting on what I had done in my previous patient eval, then I made a plan moving forward, asked my CI clarifying questions as needed, and then verbalized my plan with my CI to check my understanding. If selected for this opportunity, I would openly communicate with my CI at the beginning of the rotation about my preferred method of feedback while also listening to their preferred method of giving feedback. Then I would continue to keep that open line of communication and make improvements on our system if needed. I know CIs are super busy practitioners, so I would definitely work with them to make an efficient system for us. If selected for this clinical education experience at Craig, I would definitely maximize my time preparing for this experience by reviewing the neurological management, content specific to TBI and SCI cases, and also reach out to my close mentors that can help guide me to success. I've been very successful with the course material thus far, so I will continue to retain and advance this knowledge. I also have mentors that I currently work with at my job in inpatient rehab that I will definitely reach out to for specific advice and guidance. In my current job, I will also continue to learn, ask questions, and be challenged outside of my comfort zone while working with patients with TBI and SCI diagnoses, with the help of the PT team and the rest of the interdisciplinary team there. I will also definitely be taking the Neurological Management elective course at Regis, which I'm excited for to further advance my knowledge of this patient population. I was born and raised right here in Colorado, and with family deeply rooted in this community, I plan to stay in the Denver area after graduation. The privilege I had to walk alongside my friend during her rehab journey after a TBI is something I'd be honored to do for many other individuals in my career as a PT. Working in an inpatient rehab hospital that specializes in TBI and SCI recovery would be amazing. So honestly, working with the team at Craig has been a dream I've had for many years. Thank you so much for your time and consideration.